So tonight we're going to talk about food and reducing pain. Anyone here dealt with pain from arthritic joints? Yeah, me too. Not very much, but I've got a little bit in my thumbs. And I learned from my father actually about flax. He said, my hands don't hurt as long as I take flax every day. And I thought, well, that's strange. And then I started studying about it, and you know, he had some good science behind what he was doing. So pain is not a bad thing. Pain, as Paul Brand said, is the ever-present guardian of our body. There's a disease where people can't feel pain. It's called leprosy. Lepers, you know, they're the ones that don't have any fingers or toes. You know, the best way they found in third world countries to preserve lepers' toes and fingers? You get them a cat. How does that work? Well, the cat keeps the mice and the rats away that ate off the people's fingers while they slept and didn't know it. Because if you don't have any painful sensation, you don't wake up when the rat's gnawing on your finger. And so pain, we need pain. You don't need to be a pain, but you need pain. It's the ever-present guardian of your body. But sometimes it gets out of control. And that's not good either, because you want good function as well. And we know that a lot of the pain that we experience is because there's an imbalance in our body and there's too much inflammation. Now, those of you who have been here before, which I think as many of you know, that inflammation underlies all chronic disease. Cancer, heart disease, diabetes, all of that, inflammation. Without inflammation, it wouldn't sustain itself. The same is true with osteoarthritis. In fact, I just read an article. Usually we treat inflammatory arthritis, that's like rheumatoid arthritis, that's an inflammatory arthritis, with medication like methotrexate. Now, methotrexate is a chemotherapy drug, and it turns down the immune system. Or we use, if we're treating like lupus arthritis, we can use prednisone. That downregulates the arthritis in lupus. But there was a recent study that showed even osteoarthritis responds to methotrexate. Had you heard of that before, Dwight? Osteoarthritis, methotrexate? Yeah, just rheumatoid. I'd never heard of it with osteo, but sure enough, it helps osteo as well. Why? Because inflammation underlies both of them, and you can turn down the immune system function with methotrexate. But it's not the best thing to do, because you need a healthy immune system. So we want to downregulate immune function, but not too much. And we can do that best by staying away from drugs and using what we eat and how we live. And so we're going to talk about that today. How do you have pain be your friend and not your enemy? And so here are the things we need to do. If we want to avoid things that worsen pain, we could also put worsen inflammation. We need to avoid inflammatory foods and also foods that impair blood flow. You know, arthritis, the osteoarthritis, the degenerative arthritis that we get as we age is basically an imbalance between wear and tear and repair. If you tear things up faster than you can repair them, what's going to happen? They're going to fall apart, right? Any auto mechanic knows that. You got to keep repairing things. The same's true with the joint. If you tear it up faster than you can repair it, you're going to have problems. And you need good blood flow for good repair. And if you think about the cartilage in your joint, you don't want blood in there, but you've got to get nutrients there. And you have to repair it, and you need good blood flow all around the joint to do that. And so foods that enhance blood flow really help. And foods that are bad for blood flow really are associated with more arthritis. Well, what are foods that are associated with bad blood flow? Salt, right? You eat too much salt and your blood pressure goes up and your blood flow goes down. In fact, we know that 30 minutes after you have a high salt meal, blood flow is reduced. 30 minutes after a high salt meal. So is salt going to be good for arthritis? No, because it impairs blood flow. How about fat? High-fat meal, what happens 30 minutes after you eat a high-fat meal? Well, Thanksgiving's coming up. After you eat Thanksgiving meal, how do you feel? Tired, little sleepy. Why? Blood flow to your brain is already sludged. That's why we overeat when we're stressed, because we know subconsciously, if I eat all that stuff, it's going to turn off my thought process, and then I won't worry so much. I'll just kind of take a snooze. That's why sweets and fatty foods are some of the preferred drugs of our country, because of stress that we need to deal with other ways. So high fat, high sugar foods impair blood flow, and we don't want those. So any foods that impair blood flow will worsen joint pain, and foods that are inflammatory. Now, we've talked about this many times. How many animals, when they die, have potent anti-inflammatory compounds in them? Why would nature put anti-inflammatory compounds in a dead animal? What's a dead animal supposed to do? It's supposed to rot, right? And decompose and go away, be part of the, environment, right? How about seeds? Seeds, what are they supposed to do when the plant dies? What are they supposed to do? They're supposed to stay around till the next growing season, and so nature packs seeds with antioxidants and anti-inflammatory compounds and common compounds that preserve them. What were the crackers full of? Seeds. Why? They're packed with anti-inflammatory compounds to preserve them, and guess what they do to you? Preserve you, right? Now, I mentioned this many times before. How many people have gone fishing? Okay, what does the fish smell like when you pull it out of the water? It smells like water. You throw it in your cooler, you take it home and you pull it out to put it in the freezer. What does it smell like? Fish. Why does it smell like that? Because it's already started to undergo decomposition, oxidation. Oxidation is inflammation. And so you eat that fish and already you're going to have an inflammatory process. How's that going to affect your joints? It's going to make them inflamed too. That's why if I take a patient who's on a standard American diet and they have rheumatoid arthritis and I put them on a plant-based diet, 70% of the time the rheumatoid arthritis will go to sleep. It just stops. I had a patient who was diagnosed with rheumatoid arthritis at 20. And she was told by the rheumatologist that she was going to be in a wheelchair when she was 60. And instead she went on a plant-based diet, whole food plant-based diet, and her symptoms went away and she never had any rheumatoid symptoms or joint pain or anything. Now that doesn't happen with everyone, but 70% of the time it does with rheumatoid, which is a very inflammatory arthritis. Guess what? It happens with osteoarthritis too, when you take someone off of a standard American diet and put them on a whole food, plant-based diet. Inflammation goes down. And if inflammation goes down, your joints are better. Okay? Any questions about that? All right. So, inflammatory foods and foods that impair blood flow we want to get rid of. Glycated end products, those are foods that have been cooked at high temperature. And so how did we cook our crackers or bake them? Low temperature. We did that in a dehydrator, and we advise you to do it at low temperature, because if you brown things at high temperature, particularly if they have fat in them and carbohydrate, you're going to have a higher glycated index, and a high glycated index food causes inflammation. You remember why that is? Because foods that are glycated, the body can't use. They're bent and they're stiff, and that's an irreversible process. Now, I've used this illustration before as well. If you were building a house and the lumber truck showed up and all the lumber was brittle and twisted, what would you do? You'd send it back. You'd get inflammatory. You'd say, not on my building, you're not going to just send this back. The body does the same thing. It does not like to build itself, restore itself with glycated proteins, glycated fats, or glycated DNA. You also glycate the DNA. And remember, diabetics, we measure what? Hemoglobin A1C, which is glycated hemoglobin. And when hemoglobin glycates, it stiffens it, and the stiff red cell doesn't flow well, but it stiffens everything else in a diabetic too. The joints stiffen, more arthritis in a diabetic. The DNA stiffens, more cancer in a diabetic. The arteries stiffen, more high blood pressure in a diabetic. The brain stiffens, you double the risk of dementia in a diabetic, all from glycated end products. That's why we don't recommend a high sugar diet. Does that make sense? We're talking about joints, right? But joints are just like everything else. They're affected by our food, and we have to think about these things if we want our joints to feel good. All right. You want to avoid toxins. If you put a toxin on your skin often enough, what's going to happen to the skin? Let's say you put some vinegar on there. Not just vinegar, a nice strong acid. It's going to burn. Vinegar is acetic acid. But if you put vinegar on there and you rub it, you'll get some inflammation. How about mercury? What does that do to your body? Well, that causes inflammation too. How about DDT or PCBs or forever chemicals? What are they going to do? They're going to push inflammation up if you get enough of it. That's why you want to avoid toxins. That's why you want to eat as low on the food chain as you can. Remember Rachel Carson's book, Silent Spring? What did she find? The lower on the food chain, the lower the levels of the toxins. The higher on the food chain, the higher the levels of the toxins, because, you know, this ate and this ate that and this ate that, and they concentrated the toxins. And so, as William Castelli said, if you can't be a vegetarian, at least eat one, right? Because you'll have lower toxin levels. And that's what we want, because we want good joints. That's really important. And avoid trauma. I mean, how many of you have torn a meniscus? Yeah. Well, you got to repair that thing. Well, it's really hard to repair a meniscus. In fact, you really can't on your own. But why did you tear it in the first place? Well, it was trauma, but maybe you weren't well hydrated before you You know, I used to work at Bowdoin College. I worked there for 12 years, and I listened to the athletic trainers, and they said to the kids, make sure you're well hydrated before you get on the field. I said, why do you tell them that? They said, if they're not well hydrated, it doubles the injury rate. So avoid trauma. Keep yourself well hydrated before you exercise. Keep that cartilage nice and plump, and keep the joints well lubricated, and that will avoid trauma, which will really help preventing problems. All right, so how about include? We got to include something. Well, we want to include omega-3 fatty acids. Now you need some omega-6. Those are the ones that are more related to inflammation. They're essential, but many of us don't get omega-3 fatty acids. And where do we find omega-3 fatty acids in nature? Nuts. How about fish? Yeah, they're really rich in some fish. Why do I not recommend that? Because of blood flow and toxins. I just read an article recently. It said the time for a woman to stop fish before she gets pregnant. How far before you get pregnant should you stop fish? What's recommended now? 5 years. 5 years, ladies, before you get pregnant or before your granddaughters do. Tell them no fish. Why? Toxins. 5 years. That's a lot. So if you're worried about your joints, don't get your omega-3s from fish. Get them from what fish eat, or get them from what we gave you tonight. And that's because the fats that we eat have a lot to do with inflammation, and omega-3 fatty acids reduce inflammation, whereas omega-6s, which are found in many seeds, sesame seeds. The first time we did this recipe, I put sesame seeds in here. And sesame seeds are fine, but you don't want to use them to reduce inflammation because they're higher in omega-6 and low in omega-3. And I wanted you to feel better tonight, not worse. So we took the sesame seeds out and added hemp. And hemp are higher in omega-3s, and so are flax, and so are chia, and so are walnuts. In fact, the top plant-based sources of omega-3s are all found in the cracker you just ate. Aren't you glad? It kind of just makes those joints feel better, doesn't it? Yeah. So omega-3s will reduce inflammation. How much? Quite a bit. You know, if you have the equivalent of a tablespoon or two of flax a day, that's about like 1,200 milligrams of ibuprofen a day. Now that's impressive. Now what's the downside of ibuprofen? Well, it's hard on your kidneys. What else? It can cause stomach ulcers. What else? Raises your risk of heart attack. Raises your risk of stroke. Raises your blood pressure. I don't think I want to use ibuprofen. And furthermore, it's potent enough as an anti-inflammatory that it interferes with the second phase of healing, which requires inflammation. So you're taking this ibuprofen for joint trauma, and you're impairing your own healing. No wonder it has not been shown to reduce the need for knee surgery, because you take this stuff and you impair healing, and then you tear your joints up and they don't heal right. Whereas that's not true with flax or the natural anti-inflammatories that we're talking about. So get those omega-3 fatty acids. Number 2, get polyphenolic antioxidants. These reduce inflammation by a different pathway. And you say, well, what foods have them? Every plant and every vegetable and every fruit that has color. They follow colors. So I say, eat the rainbow and season with alliums and herbs, because alliums, that's onions and shallots and garlic and leeks, and all of those are very rich in antioxidants, and so use a lot of them. And they're just really good for you. And herbs are rich in antioxidants as well. So become a chef and use lots of those good herbs and lots of those good alliums, and then go for color. The deep greens and the deep yellows and the reds, that's where all the antioxidants are, and they're all good for your joints and every other organ system. So that's really important to understand. Number 3, I shouldn't even have to mention fiber. We've really hit this hard the last 2 times. It's so important though. Fiber reduces inflammation as much or more than the previous 2 things I mentioned. You remember last time we talked about a study they'd done in patients with severe chronic obstructive pulmonary disease, and one meal containing 2.5 grams of soluble fiber, that's not a lot, markedly improved their FEV1. That's how much air they could move in and out, actually out, forced expiratory volume in the first second. Just one meal with inulin or Jerusalem artichokes added to it markedly improved, measurably improved their ability to breathe by reducing inflammation. And that was within 4 hours of eating that. Well, that would help your joints too. So don't forget the fiber. Very, very important. All right. Now, so it's omega-3 fatty acids, polyphenolic antioxidants, and fiber. Those are the dietary keys to reducing inflammation. There are substances in nature that work like ibuprofen and Aleve and some of the other drugs that we use without the side effects. And one of them is listed right there under 4. It's turmeric. How many of you use turmeric? Wonderful. Keep using it, because turmeric inhibits cyclooxygenase. Cyclooxygenase is an enzyme that causes inflammation in our body. And there were 2 drugs that were on the market for a while, were COX-2 inhibitors. Do you remember what they were? One's still on the market, Celebrex. The other one was taken off the market because it caused all kinds of health problems, and they almost got sued out of existence, the drug company. Vioxx, do you remember Vioxx? Those 2 medicines work great for arthritis, but they cause other problems. However, in nature, we have natural COX-2 inhibitors that do not have any side effects, unless you take them in really high doses, and even then it's minimal side effects and many positive effects. And turmeric is one of those. 2 capsules or 1,000 milligrams a day is also roughly equivalent to 1,200 milligrams of ibuprofen a day, which is pretty impressive. So use your turmeric. It also has potent antioxidants in it, so you get two different mechanisms of action there. Ginger is another one. Ginger is also a COX-2 inhibitor, and ginger is a wonderful spice. My wife and I were going to make you a salad dressing using garlic and turmeric and ginger, and see how you liked it, but we decided we'd try the crackers instead. Maybe next time. I do make some dressings with that, and they're really good. I think I'll go home and experiment some more. All right, so another thing that you can do is white willow bark tea. Well, what's that got in it? Well, it's got acetyl salicylic acid. What's that? Aspirin. But isn't aspirin bad for you? Yes, if you get in a high enough dose. And it's not really acetyl salicylic acid, it's salicin in white willow bark tea. And if you have white willow bark tea, a cup a day, it will really help arthritis. You get that salicin, and how does it work? It inhibits the COX-2 enzyme, cyclooxygenase. And it doesn't do it as potently as the Vioxx or the Celebrex did, but neither do you get the side effects. Now, if you are allergic to salicylates, and there are rare people who are, do not use white willow bark tea, okay? Another thing that you can try is boswellia. What's boswellia? We're coming up to Christmas, folks. You should remember this. What did the wise men bring that was made from boswellia?
Frankincense.
Frankincense. You got it, sister. Frankincense. Yeah, it's made from the gum of a boswellia tree. And boswellia also works on the cockatoo. I recommend you try turmeric and ginger first, because I don't have a boswellia tree growing in my backyard.
Would you say ground ginger and turmeric and tea are the same as a capsule?
The ground, yes, the capsule just has ground in it. But if you'd like fresh, where's the farm? It's in Bodenham. Stone Cipher Farm. You can, at this time of year, you can get fresh ginger and fresh turmeric. And if you haven't gotten your supply, get it.
It freezes well.
It freezes really well. What my wife and I do with it is we throw it in the food processor, grind it up, and pack it in little ice trays, the ones that make little balls that are flexible. And after we freeze it, we pop it out into a plastic bag, and we've got ginger for the year in the freezer. And when you're making recipes, it's great. You just open the freezer, pull out a little thing, and you don't have to peel the ginger or anything. You just throw it in the pot. It's wonderful, and it's good for your joints. So get your turmeric and your ginger, and they're not even giving me a kickback for that. That's free advertising. Stone Cipher Farm, and it's on 24, going up 24. Yeah, before you get to Richmond. My wife went too far. I had to turn her around and via GPS and get her back.
My son sells it at the Portland Farmers Market.
Great.
Fresh turmeric and fresh ginger.
Great.
Good Shepherd's Farm.
Good Shepherd's Farm. There's another one. Great. Yes. Six Rivers as well. There we go. We got a spicy place here in Maine. And that stuff is really good for you, and I'll bet you the fresh frozen will be even more effective than the dried. So
last week, you could still get the plants and grow inside.
Great. Yeah.
Keep it inside.
And this is way better for you and tastes better than ibuprofen. Okay? How many of you like the taste of it? No.
When you put your ginger in your Vitamix or blender, can you do it without peeling it, or do you have to?
The fresh ginger from Stone Cipher, you do not have to peel it. We put it in a food processor, not the blender, though. It would turn to soup in the Vitamix, and unless you pulsed it. Yes. Okay, capsaicin. I don't have capsaicin on here, but I can talk about it. Turmeric and capsaicin are completely different. Capsaicin is found in red hot peppers. And that does not turn off cyclooxygenase, COX-2. It is anti-inflammatory. And it's good for joints topically. Okay? You can, okay, we're on to pepper. You got me there. There's a difference between black pepper, white pepper, and red pepper. If you have problems with ulcers, stick with red pepper. Why? Well, because capsaicin causes the heat in red pepper. And capsaicin is toxic to Helicobacter pylori that causes ulcers. However, piperidine is the thing that causes the heat in black and white pepper. And piperidine breaks down the mucus lining of the stomach and increases the risk for ulcers. So stick with your red peppers. You're going to have less, well, maybe you shouldn't. The GI docs would like you to, I don't want them to go out of business. Go ahead.
But I read somewhere that black pepper complements turmeric and vice versa?
It does, and it's fine, but I'd recommend you try red as well. How does it complement it? Well, the turmeric is a little better absorbed because you've broken down the mucus layer. Yeah, forget it. Just take the capsaicin. Yeah. There are some good things about black pepper. It's very rich in antioxidants. But there's some bad things too, particularly if you have a tendency toward ulcers. Yeah. Okay. Well, off of pepper. Let's see. Boswellia, we mentioned. Hops is another one. Not as beer. That's, sorry. Just hops. Bromelain, it's in pineapple. And bromelain works by another mechanism. I could not find the mechanism by which it works, but in multiple trials, it's been shown to reduce inflammation too. So what do? We had your jam made with antioxidants plus bromelain from pineapple. You can't beat that stuff. I think I'm going to have some more right now. No, I guess I'll wait. Any questions so far? Isn't this interesting stuff? Yeah. And who would have known that you could feel better by eating good things that taste good?
Omega-6.
Okay, so omega-6 fatty acids are not toxic. They are necessary, but you'd like to have a balance between the 3s and the 6s. And the 6s are rich in many vegetable oils. You'll notice I put a little note there. The best oil is olive. That's because it has a little more omega-3 than many of the others. We use a lot in this country of corn oil and safflower oil and sunflower oil and soybean oil, all of which are rich in omega-6. And that's one of the reasons why in this class I encourage people to minimize their use of oil. Because you threw out the fiber, which reduces inflammation, and now you got all the omega-6s, which increase it. Not a good idea if you want to help your joints or your heart or your diabetes or you name it. So I recommend you minimize the use of oil. If you're going to use it, that you use olive oil, small amounts, and extra virgin. Why extra virgin? Because it has more of the antioxidants still in it. If you want to do yourself a real favor, try olives. Right? It's got all of the fiber, all the antioxidants, and it's better for you. Yeah. Pardon?
It said and stuff some grape leaves.
And stuff some grape leaves, absolutely. Grape leaves are excellent too. All right, any other question here?
You mentioned soluble fiber.
Right.
A little while ago, there are a lot of products that have that in it.
Right.
Do all the soluble fibers meet the requirements?
Well, insoluble fiber also reduces inflammation. I just mentioned the one study that had it. Oats are rich in both kinds of fiber, but particularly soluble. And many of the beans have both. They're rich in soluble fiber as well. Inulin or Jerusalem artichokes, inulin is a type of carbohydrate that's treated by the body like a fiber because we can't digest it in the upper gut. It's digested by the bacteria in the lower gut. So it works like that. Chia, yeah.
Psyllium.
Flax, psyllium, yes. All of those have soluble fiber as well as insoluble. And you need both, and if you just eat food, you'll get it. Yeah. So, all right. And then one more thing here, and that's hot and cold treatments. How many of you have had a really sore joint and iced it? Yeah. It takes the pain away. It reduces the inflammation. And ice is really good. But if you keep using ice and you never switch to heat, it'll inhibit healing. And so we usually say ice a joint for the first 24 hours after injury and then start using heat and alternate. Why are we alternating? Well, the ice reduces the swelling, so we end with ice. The heat brings the blood flow there, and and helps the ligaments, and so we alternate it. And so often what works best on a newly injured joint or one that's arthritic is alternating between hot and cold. 5 minutes of heat and then 30 seconds to a minute of ice, and back and forth, 3 rotations. Before we had good drugs for arthritis, they used to have hot wax dips. Anybody try those? Yeah, they work. You just dip your hands in that paraffin, and then you pull them out, and then you dip them again, and you pull it out, and it keeps that heat in there, and the blood gets down there and provides healing, and then you peel it off and dump that paraffin back in, and you do it the next day. And it's really slick, but nobody does it anymore because you can take a drug. But now you can do that and take some food. All right, well, think about it, try it, see how it works, and above all, enjoy those good crackers, right? All right, thank you very much.